Good morning, students. I am Abisha, Assistant Professor from the Department of Biomedical Engineering from Emmanuel Arasar JJ College of Engineering. Today, we are going to learn a new topic about mammography. First, we are going to see about what's meant by mammography. Mammography is a special type of X-ray imaging used to examine the breast. It helps doctors to detect the breast disease, especially the breast cancer, at an early stage before the symptoms were appearing. Early detection improves the chance of successful treatment. In mammography, digital imaging technique uses the low dose of X-rays, which produces image of the breast to detect the abnormalities such as lumps, cysts, or tumors. Then we are going to see about what are the basic components of a mammography. First, first component is the X-ray tube. And the purpose of the X-ray tube is to produce the low energy X-ray. Next, the compression paddle. The purpose of the compression paddle is to compress the breast to improve the quality of the image. Next is the image detector. The purpose of the image detector is to capture the X-ray image. And the next component is the breast support platform, which will hold the breast during imaging process. And the next one is the digital detector. The purpose of the digital detector is used to convert the X-ray into digital images. And then it is given to the computer workstation where the image where display stores and the processing of images will take place. This is a mammographic machine. This is a mammographic machine where it's used for X-ray imaging of the breast. First, the patient will be standing in front of the mammographic machine and one breast is placed on the detector plate. Then the X-ray tube will produce low energy X-rays and then passes through the breast and are absorbed differently by tissues. The compression paddle gently will press the breast and the detector is placed on the detector plate where the detector captures the transmitted X-rays and convert them into a digital image. Then the converted digital images are taken from different angles. The types of view here shown are CC view and MLO view, where the CC view is the coronal view, where here the X-ray beam passes from top to bottom, which will be showing the central and medial portion of the breast. And the MLO view is known as medullolateral oblique view. Here, the X-ray beam is angled at 45 degree, showing the upper outer breast. Next, the images will be given to the digital image. Here, the computer processes the detected signal into high resolution mammographic images. Then, the images are displayed in the computer display where the uh, brightness of the images were adjusted in this computer display. Then it will be given to the radiologist review to examine the image for abnormalities. Next is the type of mammography. Here there are four type of mammography and the first one is the screening mammography. In the screening mammography, it is used to perform on women without any symptoms. The purpose of this screening mammography is used for early detection of breast cancer. Usually, it is recommended for women above 40 years of age. Next is the diagnostic mammography. Diagnostic mammography is performed when abnormalities are present in lump, pain, nipple discharge, or abnormal screening result is present. It will be providing additional view for accurate diagnosis. And the third one is the digital mammography. Here the images are easily stored and shared electronically. Here the images are captured digitally and the output image will get a better quality of images. And the last one is the 3D mammography. In the 3D mammography, it will produces a multiple thin session images of the breast. Here, it improves cancer detection and it also reduces false positive results. And the advantages of digital mammography are it has high diagnostic accuracy, it is quick and simple procedures. Here, it uses a low dose of X-rays. Then, it is used to detect the breast cancer at the early stage. Next is it helps to guide for further treatment. And the disadvantages of mammography are mild pain or discomfort will occur due to breast compression. It uses a small amount of radiation. It may miss cancer for the dense tissue. It can give a false positive or false negative result. Sometimes an additional test or biopsy is needed. And next is the safety precautions of mammography. First, inform the doctor if pregnant or breastfeeding. Avoid using perfumes or powder before the test. Wear comfortable clothing. Position the breast correctly and apply only the required amount of compression. Keep the patient still during the X-ray. Regularly maintain and calibrate the mammography machine. Okay, students, that's all about the mammography topic. Thank you and have a nice day.